um, died of drug overdose. Now, this is a medical student who Asian people don't take drugs as much. If you look at the statistics, this very low, drug overdose there. But this kid who was so intelligent, I knew him from beginning, and he died of overdose, then there is a problem. This guy is not mentally ill. It was not mentally ill. And so I went home and I said, well, what is happening? And I talked to some folks. Well, this looks like in 2014 we are here. And then I looked at the graph, and the graph, as you can see, is rising from 1999 to 2014. You have a pointer here? Oh. Did I slap this? Sorry about that. Sorry for a very, very busy slide. How do I get the pointer up? Sorry for a very busy slide, but I had to do it this manner because, so the graph, as you say, 1990, this is before Dr. Kevorkian was here, and then this is 2014 I'm talking about when I met this thing. So it has been rising. I talked to some people why this is happening, why there like suddenly 3 times number of death in last 10 years. I mean, America didn't just become mentally ill 3 times. You know, there has to be a reason for it. So people keep blaming it's a chronic pain, a mental illness, we need to increase mental beds. That's not the problem. There is a problem that somebody is making America mentally ill. And well, I said, well, why this is so silent? Why nobody knows about this? I didn't know as a doctor that this epidemic was happening. And as you can see, in spite of all this happening, our Surgeon General, 2011 call to action was breastfeeding. This is when we had around 250,000 people have died. 250,000 Americans had died by that time, and 2011 call to action was breastfeeding. 2014, when around 400 people have died, 400,000 Americans had died by that time, the Surgeon General's call to action was skin cancer. Okay, from this whole 10 years, there was not a single mention of drug overdose. So what was the administration doing all those years? Why people didn't know about it? You know, as a doctor, I should know there is an epidemic going on, but nobody wanted to talk about it. I say, why don't anybody wants to talk about it? Well, these are addicts, they are dying, society needs to be clean. Okay, so then 2016-15, we had Surgeon General Dr. Vivek Murthy, and he happened to be a friend of mine, and I was really upset when he called the call to action walking for fitness. Yes, walking for fitness is important, but we are a nation where 450,000 people have died by that time. You have to take call to action on drug overdose, and that's what we. And another thing, I mean, you probably, a lot of you are from media here, or media only talked about Ebola virus and Zika virus that didn't kill a single person, maybe 1 or 2 people. Even President Obama had a Ebola czar there, and Zika virus was on the news all the time. Nobody talked about opioid epidemic for 10 years. 10 years. So next slide, please. So I thought Dr. Kevorkian was back now again, 1,000 times stronger, and killing people like anything else. And you know, I wrote I did a petition on the website called change.org, which was signed by 12,000 people within a week. And these are the families whose kids had died, their daughters have died, and you have to read those comments and visualize what was happening in real America and what was happening in Washington, D.C. It was totally different. There was a disconnect. These are not mentally ill people. These are innocent people which were killed over those last 10 years. And we also wrote a letter to President Obama at the time, and which was supported by Congressman Gabbard, Democrat Congress, and she spoke on the floor. She tweeted, well, we need to take a call to action on opioid epidemic. And then we had a letter from our local congressman, Norcross, who wrote a strong letter that you have to take a call to action on opioid epidemic. We did see a lot of activity after that, but this is after 500,000 deaths in America, we are seeing activities. So no wonder we had an epidemic which was kept under the rug and keep growing and growing and growing. Next slide, please. So we have seen two great storms in our country. One was Wall Street storm, as you saw, which totally took the country, down. And then we have this storm, which is probably bigger than that, both financially and the number of deaths has been caused. And they did it legally. Nobody has been arrested for Wall Street. They were bailed out. And here it's being done legally, but it's immorally. And I'll give you an example. I can give at least 100 examples here, but I'm just going to give you one example. A series of centers in Philadelphia, 2015, they were raided by DEA. I know this because it was on the news. They were writing so much the pharmacy won't fill the prescription for them. Literally, they say, well, if this is coming from this center, we are not doing anything. And then, so it was raided in 2015 and then reopened. Within a week, it reopened. It was re-raided in 2017, October 23rd, 2017, which is 6 weeks ago. And then reopened on November 1 of 2017. So we have a pill mill running in different parts of the country. Pill mill, these are writing legally. Of course, they're writing legally because otherwise they would have been caught. Nobody is able to stop them. And these are the people who are causing drugs on our street to go legally. And who is paying for it? The health insurance pay. 250 million prescriptions are being paid by health insurances. One of the reasons this epidemic is so strong, if you can name a single industry that benefits from this opioid epidemic going away, there is not a single industry. Even paper, 250 million prescription, even paper industry is making money. I cannot think of a single industry. I'm so proud of these funeral homes who are saying we are so busy, but please stop these deaths. We don't want to be busy. We don't have place for these bodies. So really, we need to understand this. It's nothing to do with mental illness. Nothing. It's nothing to do with chronic pain. These are the victims. We need to find the real enemy which is there. And that's why we are doing all these things and nothing is happening. For 15 years, they have spent at least $16 billion on this epidemic. 2013 to 14, they spending another $1 billion. Number of deaths increased 13% because they are going after wrong enemy. Increasing Narcan, teaching these doctors for last 10 years, increasing bet, not going to do any effect. Here is another example. A billionaire farmer, he created Insys Therapeutics, a substance 100 times stronger than morphine, 100 times stronger. And he bribed. Look at the stock. It probably rose as much as the death curve rose here. This is why the deaths were high. This nothing to do with mental illness. These were rising because these greedy people kept these innocent people on the hook for this. Next slide, please. And next slide, please. So, I'm going to skip a few things here. I can just say this is very important. 75% of the addiction starts with a prescription. Next slide, please. Next. So, I want to say this is the launch of our national tour that's going nationally. We are going state by state, educating the lawmakers, educating the doctor community to take steps and bringing as much awareness as we can. Next slide, please. We also starting a public campaign for this. I think public is very important. We are joined by several athletes here who is going to help us in this campaign to raise awareness of the public that these are the innocent people who are being part of the victim from greedy companies. Next slide, please. I mean, a lot of these companies have spent so much money developing opioids stronger and stronger and stronger and stronger. Why don't they look at the substances we have? We have so many substances. They can start evaluating drugs which are right in front of our eyes. Next slide, please. So our main message to the government is, yes, you have called emergency, but that is not enough. You have to call a war against this. We have to have a call at the war at the central level. We have to have a call at war at the state level. Every state and center has to have a war room. They have a command room where all these agencies come together. You will be surprised. Last 2-3 years ago, CDC wrote the guideline. FDA was fighting with them. You know, they said, well, it's not acceptable. So we need to, I mean, we are a world leader. We are the most powerful nation on the earth, right? So we can do this war if we do it properly. Next slide, please. And never underestimate the enemy. Our enemy is very strong. They are organized. I have been to those meetings. They say, oh, there is no epidemic. 200 million people taking prescription, only 60,000 are dying. That's a low percentage. More people die with NSAID. They don't care. They are very organized. So, well, even if the government doesn't take action, they don't do a war, we can do a war from our efforts. I will like you to promise me that you will do the war, because together we definitely can win this war. Innocent lives are at hand. Please join me in Turn the Tide campaign. Thank you. And now I would like to invite the champion of the effort, Governor Christie, chair of the White House Task Force, who has put a lot of time and effort on this cause. And because of him, we definitely inspired, and we definitely will take this nationally.
For medical education, starting in medical school and continuing medical education, to be able to renew your DEA license to write these prescriptions. Imagine, I haven't actively practiced law in the last 8 years. Yet, for me to maintain my law license, every year I have to take continuing legal education. But doctors who write these prescriptions for drugs that addict and kill can continue to get their prescription license renewed time after time after time with no requirement for continuing medical education. And we see from the statistics that Dr. Gupta showed that this situation has evolved and worsened over time, which means that our physicians should have been told about the fact that they were contributing to the death of tens of thousands of Americans every year, and that maybe they needed to take a look at alternatives to what they were doing. That was not done. Not required by the DEA, and that's why we've asked the President to require the DEA to have continuing medical education on the issues of addiction and opioid prescribing in order to qualify. 55 million prescriptions were written in 2016 for opioids in this country. That's enough for every adult American to have their own bottle of 30 pills. There's no way that that's an appropriate use of a prescription pad. No way. And that's where the supply happens, not only for those people who take the drugs appropriately and as prescribed, but also those are the pills that wind up not being used and are diverted for sale, and diverted to others whose name is not on that prescription bottle, but who take it out of their mother or father or grandmother or grandfather's medicine chest and decide it's time for them to try this. So we know that the issue of supply is important, but the issue of supply has to be managed here in the United States, because we are the place of predominant demand in the world. We consume 85% of the world's opioids. 85% of the world's prescription opioids were 4% of the world's population. I mean, I went to law school because I wasn't good at math, but even I can do that math. That makes no sense. We are driving this, and the pharmaceutical companies who have produced these medications are driving their usage for profit. I have no problem with profit. I'm a free enterprise guy. I think folks in this country should drive to work and make as much money as they can possibly make, but not at the expense of the lives and the health of the people of the United States. And so, what do we need to do? That's why the Commission has recommended and already implemented a partnership between the major pharmaceutical companies and the National Institutes of Health to do two things: to work together to develop more non-opioid pain relievers, because we do have real pain in our country that has to be addressed. And secondly, to give us more options than the three we have right now on medication-assisted treatment for those who have already fallen victim to this disease. To have only 3 options is not enough. We need to have more, and those options need to be more broadly distributed around the country and used by folks more than they're being used right now. Let's go to treatment as we bridge from medication to the other types of treatment. The fact is, treatment is not broadly enough available to people in this country. Only about 11% of the people who need treatment are getting treatment. Well, then we shouldn't wonder why more people are dying and recidivism in the criminal justice system increases among these folks, because we're sending addicts into jail. We're not treating them. They remain addicts, they leave jail, and we expect that they're not going to commit crimes to further the disease that they have. They will, and they do. And that's a natural human reaction. We need to break that chain through treatment. And not only medication-assisted treatment, but all the other treatments that are available, because we know that many of these diseases are co-occurring. We know that folks who have the disease of addiction often also have other mental health issues that we need to confront. It becomes a chicken or the egg argument with some folks. And we shouldn't be having that argument. We should be dealing and giving holistic treatment to folks who have this disease. Right now, quite frankly, we're giving barely any treatment at all. And that's why we've asked the President, and the President has agreed to eliminate the IMD exclusion in Medicaid. And so now we've gotten our waiver, 4 other states have gotten theirs, and every other state should apply for their waiver. What will this do? It'll allow people who are suffering from this disease and who are on Medicaid to be able to get treatment, because it will open thousands of more beds across the United States. It's an old, antiquated Medicaid rule about psychiatric hospitals that doesn't apply to the crisis that we're facing today. And so I'm glad that we've gotten that exclusion waived, and every state should be in for their waiver to open up beds all across their state to be able to provide, especially for the indigent population in Medicaid, more opportunities for treatment. We need to make sure that the Department of Labor starts to regulate our national insurance companies. A big part of this problem is people who have insurance. Employer-based insurance. 70% of the employer-based insurance in this country is not regulated by individual states. It's regulated by the Federal Department of Labor under ERISA. And how about what we discovered at the Commission when we brought the Secretary of Labor in and asked him, why aren't you being more aggressive about making sure that folks who have mental illness and addiction disease, that they're being treated with parity to all other diseases, heart disease, diabetes, and all the rest? Because we have a law for 10 years, the Mental Health Addiction Parity Act, that says it's supposed to, but it's not happening. Why isn't it? Well, just Congress in its infinite wisdom said that labor has the responsibility, but they can't find people who are violating the rule, and they can't investigate individual insurance companies. They must investigate through employers, one at a time. Well, you know that was what that was designed to do. I know as a governor how that happened. The insurance company lobby came in and put that in because they said, geez, if we get these 2 things in here, they can say whatever they want in the act because we can act with impunity and no one will be able to penalize us for it. So we have people who are paying for health insurance and employers who are paying for health insurance who can't get the coverage that their employees need and that they're paying for to be able to get them into treatment. That's wrong. And so we've urged the Congress to change that law to give the Secretary of Labor the authority to fine insurance companies who are not complying with the law, and to be able to investigate the insurance companies themselves directly, rather than have to go employer by employer, which will mean the job will never get done. These things are important because folks who have health insurance believe when someone gets sick, they should be able to get treatment. And that's true with almost everything but this disease. That's wrong. And the only way we're going to help these people and prevent their death is to make sure that we change those laws. To prevent death, we also need Narcan to be available with every law enforcement officer in the country. Every EMT, every member of law enforcement should have, along with their gun, doses of Narcan to be able to administer when they come across someone who's in the middle of an overdose. We know that Narcan works. We know now that the way it is been able to be given doesn't need great training. It can be given nasally, through the nose, 2 puffs, 2 pushes of a button, and it's done. And you can reverse a deadly overdose. Now, that's not going to solve the problem because the person still who is laying there needs to be detoxed. They need to get treatment. But we can't detox them. We can't treat them if they're dead. And let's remember that 175 people are dying every day. Every day. That means we have a 9/11 every 2.5 weeks. Think about that. If we had a terrorist organization that was infiltrating this country and was killing 175 Americans a day on American soil, how much would we pay to make it stop? We can't even calculate the amount of money that Americans would be willing to pay, and you can only imagine, and for those of us who are alive on 9/11, we remember the way the country came together to empower the government to do whatever was necessary not to have it happen again. That was one day. Deaths in one day. That's happening every 2.5 weeks. 64,000 people dying last year, and I am confident somewhere between 70 and 75,000 people will have died this year by the time we're done counting them. Narcan keeps those people alive temporarily, and that's a good thing. Because life is only salvageable through treatment if we avoid the initial death from the overdose. And with fentanyl and carfentanil now becoming more prominent in our society and being much stronger than heroin, much more lethal, one try, one dose can kill you. So Narcan needs to be available to try to reverse that. In the end, there's not going to be any one silver bullet. I just hit a couple of high points. There are 65 recommendations in our report to the president. The good news for you is I'm not going through all of them. But the report's available online on the White House website, and I recommend it to you because it not only lays out the recommendations and the basis for those recommendations, but it also gives you a history of how we got here. And we got here through our own neglect, through our own lack of education, and through a government that was regulating hospitals to say that pain was a vital sign, and that you had to have a 0 in pain in order to get that smiley face that evaluated the hospital well, that impacted their ability to be reimbursed by the government. The government was complicit in this as well. I want to reduce Americans' pain, but I have no interest in eliminating it if opioids is the only way I can eliminate it. Because I'm just substituting one pain for another. And that's unacceptable in this country. I'm going to open it up to questions in a second, but I just want you all to think about something. Because this is the last point I think that we need to accomplish in order to really try to deal with this problem. And that is the shame and the stigma of this disease. Now, my mother was an addict. She was addicted to nicotine. She started smoking when she was 16 years old in 1948, when no one really knew that smoking was bad for you. But by 16 years later, when she was 32, the Surgeon General came out with its report saying that smoking causes lung cancer. My mother kept smoking. She tried. I saw her try over and over again to quit. She just couldn't. And so inevitably, 55 years after she began smoking, she was diagnosed with lung cancer, and 4 months after her diagnosis, she was dead. But during that 4-month period, no one ever came to me and said, "Chris, listen, heard about your mom. You know, she's getting what she deserves. she knew what smoking could do to her. She kept smoking. She's getting what she deserves. No one ever said that. No one ever said, well, it's her choice. Too bad. How long she got left? No, exact opposite. People telling me they were praying for her. People recommending doctors, hospitals, different treatments, different surgeons, different oncologists that they or friends or family had had success with. They went and visited with her, comforted her, and called us and comforted us. And I wasn't ashamed to tell people that my mother had lung cancer and she was a smoker. I didn't think it reflected on my dad. I didn't think it reflected on me or my brother or my sister. I wonder if my mother had been a heroin addict if I had felt the same way. I wonder if I would have told people that my mother was dying because she was a heroin addict. I wonder if people would have recommended doctors and treatments to her if I had. I wonder if they would have prayed for her and came to visit her in the same way they did. I suspect you know the answer. It's probably not. See, today, there's lots of different diseases that human behavior impacts. Heart disease, diabetes, cancer, that human behavior contributes to. Yet we don't say those folks shouldn't be treated, and we're not ashamed to talk about their disease. Yet here we are. With this disease we make a moral judgment. And I think an inappropriate moral judgment. And that moral judgment prevents people from asking for help. It prevents the addicts from asking for help and causes them to hide in the shadows because they're ashamed. It causes the family to not want to ask for help because they don't want to be identified as having a family member who's a heroin addict. I ask you all a question. Anybody in this audience? Anyone in this audience who's never made a bad judgment, raise your hand. Good. My record is untattered now. No one's raised their hand yet. And I've done this all over the country. We all know we've made bad judgments. Here's the good thing for, I think, most of you in this room. Your bad judgment wasn't trying drugs. Because if it was, there but for the grace of God go I. There but for the grace of God go I. And we need to understand that just because someone makes a bad judgment and tries something, starts something in the beginning, that doesn't mean that they should have a moral scarlet letter on them for the rest of their lives. It means they made a bad judgment, like all of you have made a bad judgment in your life, or maybe even more than one. Tough thing for me is all my bad judgments play out on the front page of the newspaper. That gets a little more dicey and less deniable. But the fact is, we all have to get rid of that feeling and let people know that whatever their bad judgment was, if they want help, we're here to help them. If they want treatment, we're going to get treatment available to them. And that their families, I can't tell you how many times I go and I visit treatment centers, and when I speak to people who are in the midst of treatment, in the throes of their addiction, one of the first things they say to me is, but Governor, by the way, when they're telling me their story, I come from a good family. My answer to them now all the time is, of course you do. Why would you think I would think otherwise? They think it. They think I'm thinking it. That's what holds people back. In the mid-1980s, AIDS was the same way. The beginning of the AIDS crisis, right? It was the gay plague. It was we imposed our moral judgment on their conduct and said, well, you're getting what you deserve. But when Ryan White turned up with AIDS and Magic Johnson turned up with AIDS, the country started to understand that this wasn't about a moral judgment, but it was about people who were sick and dying. And what happened? I remember, because I was living during those times, there were marches all across this country, in every state capital and on Washington, D.C., demanding that the government find treatments for this disease so that it would stop being a fatal disease and start being a chronic disease. And now today, 30 years later, AIDS is no longer a death sentence. But it took people marching. And with 64,000 people dying last year, in every neighborhood in this country. I don't care whether you're black or white, Hispanic, Asian, rich, poor, well-educated, uneducated, every one of those groups has been touched by this epidemic. Where are the marches? Where are the demands for the government and the private sector to work together to make this a chronic disease and not a fatal one? I'll tell you that until we do that, none of the other things that I mentioned before and a whole bunch of others will be possible. So it's up to us. I agree with Dr. Gupta on that. It's up to us. We got to decide. And I will tell you that once you have it touch someone close to you, the need becomes much more urgent. And all I'd warn you is, if you wait too long, it will come. It will come, and that pain is significant. So that's why I'm so committed to this cause. That's why I believe it is the public health crisis of our generation. And that's why I believe we need to work together to fix it. So I'm happy to take some questions from folks on this topic. And I appreciate you all being here. And I appreciate Dr. Gupta giving me the invitation and bringing his national tour to Camden. This institution understands this issue. Cooper does. They believe in it. And I'm glad to be here, and I thank all the executives at Cooper for hosting us as well.
Actually, Governor Christie, can I ask the first question?
Well, you're Dr. Gupta. I guess you can.
So, we are the most powerful nation on the earth. We can win any war, but this war we have failed miserably, literally. And how do you explain, I can't understand, our Surgeon General for 2001 to 2015, how come Surgeon General didn't take it as a priority? I mean, I'm not in administration. I don't know how government works, but even a child, 6-year-old child will do that.
Yeah,
Please explain to me, how did it happen that 2011 breastfeeding, 2014 skin cancer, 2016 we had, walking for fitness.
Yeah. Well, welcome to government. I hate to tell you that there are times when government identifies crises by what they believe will be most politically popular. I did not know there was a breastfeeding crisis. But, you know, I'm sure it's an important issue to lots of people. I know it was an important issue to my wife when we had our 4 children. But I will tell you this, my wife is much more concerned today about our 24, 21, 17, and 14-year-old in the context of this crisis than she was ever concerned about any issues that she had over time with breastfeeding. The problem, though, is that we make these crises until they become absolutely overwhelming political. And we identify what we think people want to hear us working on, rather than on what they really need to hear. This is an unpleasant subject because the death is everywhere. You can't look at it and go, oh, yeah, well, look at those poor people. It's us. And I think that government refused to respond to it because it was not politically correct to do it. And now they have to because the country is overwhelmed by the death. And we're going to see increases in death for a couple of years at least, even if we start to implement everything that we recommended in the commission's report. You're still going to see an increase in that because we are so far behind the curve. And we have to play catch up. And when you have to play catch up, there's still going to be a lot more dying. So I wish I could give you a better explanation than politics, but that's my explanation. I think it was not politically correct or politically popular to talk about it. And because it wasn't, even though that's not the way the Surgeon General should be making his or her judgments, I'm pretty confident in 2 different administrations, in the Bush administration and in the Obama administration, that nothing was done. And all you need to do is go look at 2 GAO reports that were issued during the Obama administration about their approach to drug addiction in this country. And both of those reports that were submitted to the president said that that administration's approach to the drug addiction crisis was an abject failure. So they had plenty of warning too. They just didn't want to listen. They didn't want to listen. Oh, I'm sorry about that.
You said 60 recommendations.
65.
65. How does the commission make sure that pharmaceutical companies actually comply and take in some of these recommendations? What are the next steps?
The commission doesn't. The commission has given its expert recommendations to the White House and to Congress. And now it's up to them because they're the ones who are elected to do it. Now, I'm going to continue to talk about this issue even after I leave office and continue to push on these issues, and I think lots of other leaders will and need to. But in the end, this is a part of our democratic process. They now need to put their money and their efforts where their mouth is. And we've heard a lot of talk about this. We've given them the blueprint for what to do, and it's a nonpartisan blueprint. We had 6 members of our commission, 3 Democrats, 3 Republicans. But I will tell you, we never had one disagreement on the commission about what to recommend, because these are not partisan issues. These are evidence-based issues. Yes, sir. No, I want to get to more people. Go ahead. I want to get to more people. Thank you. Next.
How do you plan to incorporate athletes and work with them to get in touch with community education, research programs?
We want them marching and speaking. I mean, I think it's so important. And listen, I use the AIDS example because I think it's very apt. And think about how the AIDS crisis was dealt with after Magic Johnson came out and said he was suffering from AIDS. Think about how different everyone approached it. And think about the grace and the strength that Magic dealt with it. He spoke about it all the time. He didn't hide. Magic didn't go into hiding. In fact, he went back to playing for a little while after that, as those of us who are as old as me will recall, right? So what we need from our athletes we know that our athletes suffer pain, especially those in significant contact sports, and we know that they've been handed this stuff over and over again to keep them on the field, right? So we need them to be talking about the effects that these drugs had on them, and to talk to young people, because remember, most of our addicts right now are younger people. And athletes have, for many of the younger population, have a disproportionate impact in terms of the words that they say. And we've had great partnerships in New Jersey in the work we're doing with the Jets, the Giants, the Devils. I'm doing an event with the New Jersey Devils tomorrow night. The Jets and Giants have been great partners in advertising, in providing both current players and former players to come and speak to groups that we've moved them to. And so I absolutely believe that the athletic community, having been so directly affected by this, will be really strong voices, and they can help kids who want to be like them stop this part of being like them.
So you're working with the likes of Harris Blitzer, Sports and Entertainment, Athletes Prepared.
We're dealing with every team and every league that's willing to be a partner, and they're all stepping forward now. And in part because of what Dr. Gupta said, it's so obvious of where the crisis is now. Everybody wants to try to be a part of the solution. So we're at a good moment, but we gotta exploit the moment, because if we don't, it will pass and something else will come. We know we have a short attention span society, so we got to get people's attention while we have it. The young lady in the back.
Governor, so my mother too was an addict and succumbed to cancer because she was a smoker and such. So I agree with you. It wasn't considered, we didn't damn her. We wanted to help her. Having said that, I served for 12 years as a board member for the Free Library of Philadelphia, and I'm here to tell you that folks are coming to libraries to overdose, and so we are now, people who are working in the libraries now not only have library cards, but they are being equipped with Durham. And I think as a part of your campaign, I don't know if you touched on this, I'm speaking from Philadelphia particularly, organizations like the Philadelphia Library or other libraries across the country can be very helpful in this, because we know that a lot of times folks who are immigrants or really struggling come to libraries as a hub. We see more than our fair share there. So curious to know what you have.
It's a great idea. Hadn't thought about it before, and would love to incorporate it. I mean, that's what this dialogue is all about, right? I mean, because in every different part of the country, people are going to see this manifesting itself in different ways. And so in major cities in our country, you're right, the public libraries are huge hubs for people, because it's a place that they know they can go where it is quiet and safe and welcoming, right? And sometimes that's for good reasons, and sometimes it's for bad reasons. And so I think it's really great. Yes, sir.
Yeah, thank you. I first want to commend the commission on its report. I think sometimes things are designed by committee and a panel, but that's not the case. I don't think there's any pain expert in here that would say anything in that. If that report, all those different policies that you put forward are enacted, that it will not address the crisis. So
Thank you.
My question is, around the use of opioids, like abuse-deterrent opioids, that are designed to make abuse by non-intended routes, non-oral or IV injection, make that more difficult. Do you see them do you believe they have a role, or?
Listen, I think they have a role. I don't know whether they have a significant role, but I think they have a role, and I think we have to continue to examine that as we move forward as part of an overall solution to the problem. But I think the problem is so severe that there are very few alternatives that we can say doesn't have a place. Because when you look at the chart that Dr. Gupta put up there and the incline in that chart on the number of deaths, we shouldn't be rejecting any potential solution to the problem. It's just so severe. And you talk to anybody, I guarantee you, I'm sure you already know this because you're here. I mean, you talk to anybody at any event you go to, I don't care whether it's a sporting event, whether it's a cocktail party, whether it's a dinner event, a charitable event, this topic is coming up. People are feeling it. And we need to take every bit of help we can get to be able to, because every life we save is precious. And I don't want to sound trite about it, but believe me, if you spend as much time as I have with the parents who've lost their children, they're looking for the solution to their one problem, right? And if they felt like that their child was in detox rather than dead, they'd take it tomorrow because it's still a little glimmer of hope. Yes, ma'am.
So I'm one of the ER and addiction physicians here at Cooper, and one of our biggest barriers to starting treatment in the emergency department is the issue of prior or authorizations for buprenorphine. So no other opioid has that requirement except for buprenorphine. New Jersey eliminated that for private insurers, but it still remains for Medicaid insurers, and that is our population. What has New Jersey done to eliminate that as other states have done?
We've requested a waiver for Medicaid. We're waiting to hear back. And quite frankly, we recommended in the report that should be gotten rid of system-wide by Medicaid because it's a huge barrier. And, you know, buprenorphine is one of the 3 medication-assisted treatments we have, along with methadone and Vivitrol. So we want to make that more broadly available. And the barriers that were put up to that, there's a whole political history, as I'm sure you might be aware, part of it, of why those barriers were put up to favor certain treatments over others. But we recommend in the report the elimination of all those barriers for all 3 of those drugs. Yes, sir.
Just want to make a comment. You stated earlier that attorneys have to get continuing medical education to continue your license. Physicians do have to take 100 hours every 2 years of continuing medical education, and they have recently added that if you want to continue your narcotic license, you have to get 2 hours additional to maintain that license.
Yep. DEA does not yet require it, though. That's a state by state. It's just well, but my point was that the DEA could do this with one swipe of the pen nationwide, because DEA is ultimately the organization that permits the licensing of physicians to write these prescriptions. And so for the states that already require it, New Jersey does, Pennsylvania does, those states are to be commended. But there's plenty of states that don't. And my view on it is we don't have time to wait. So the DEA could do it with one signature, and they should do it. They should get it over with, because then we don't have to worry about each state going, you know, one by one to get to 50. Yes, ma'am.
Governor Christie, my family is one of those that has been touched by this crisis. We nearly lost a child. Thank goodness we did not. She's recovered and doing very well. So I'm very grateful for the work that you're doing and very interested in the work you're doing. I was also on the committee that developed the National Pain Strategy report, and I'm very concerned, especially about the approximately 30 million Americans who live with what we define as high-impact chronic pain, who have really become collateral damage in this battle, this war, as you referred to it. We heard from Dr. Vanila Singh at HHS before you came in today, who is working on implementation of the National Pain Strategy. Vanila asked me to give you her card before you left and to see if you two could talk. The project I run is called PAINS. It's an alliance of national organizations that are concerned about both of these issues. We believe strongly that comprehensive chronic pain care will, in fact, improve the lives of millions of Americans. It will reduce costs. It will also reduce opioid prescribing. So I'm pleading with you and Dr. Singh to collaborate with one another. The CARA Act does, and its 5 articulated strategies include advocating for comprehensive chronic pain care. So I am pleading with you to please, in your talks and in the work you're doing, to incorporate that into your thinking.
It's in the report.
I know
I'll take her card. It's in the report, and I'll also tell you that we're seeing real progress in this in the VA. Now, we went out to the Lewis Stokes Hospital in Cleveland, Veterans Hospital in Cleveland. They're doing extraordinary things with alternative pain therapies for veterans who are suffering from chronic long-term pain due to their war wounds. Yes, and Secretary Shulkin of the VA has mandated that now through every VA hospital across the country as a result of the report. And what we've seen at the Lewis Stokes Center, which is the most advanced one in the country, they were doing it first without any order, is they've seen a 35% reduction in the use of opioids by veterans because they're getting things like acupuncture therapy, massage therapy, aqua therapy, and lots of others, right? And so what is that doing for veterans? It's getting them off opioids, and it's also dealing with the serious pain that they have from the wounds that they've suffered over the course of their career in the military. So what we've recommended in the report is not only the implementation of that at every VA hospital in the nation, which Dr. Shulkin has now ordered, but also that private hospitals should be looking at this same thing. Now, barriers, well, I was see, you anticipated my next statement. And that's why the Department of Labor portion of the enforcement of the Mental Health and Addiction Parity Act is so important, because insurance companies would rather reimburse for 60 Percocet than they would for the alternative treatments that you're talking about. And so as a result, that's what they do. And physicians react to that often, not always, but often by saying, all right, well, we're not going to get reimbursed for this, and the patient as well, then I'll do this. Insurance policy guides healthcare policy to an extent in this area. And that's why we believe that changing that law to give the Department of Labor the teeth that they need to enforce the law is the right way to go. I can tell you that if I know the current Secretary of Labor, he was the United States Attorney in Miami when I was the U.S. Attorney in New Jersey in the Bush administration. If you give Alex Acosta the ability to go after these companies for not following the law, I have complete confidence that he will. And, you know, all we'll need to do is make a couple of examples. Big fines, bad publicity. These companies will turn really quickly, but we need to. And we now have an evidence-based reason to show them to do it because of what's going on in the VA hospitals. As we know, the VA hospitals have been a laboratory often for lots of great health improvements over time that they've experimented and worked hard with veterans who come back from war with these problems. And now a lot of those solutions are used across all medicine that were begun in VA. I think this will happen here too, but we've got to be able to make sure that insurance companies reimburse these when physicians believe that this is a viable, effective alternative to deal with the people who are suffering from chronic pain. And that's all we're asking for, is to leave this in the decision-making province of the physicians. Let them decide what the most effective way, with a balance of the risks and benefits to the patients. Doctors do that very well, but they're being restricted from doing that because of insurance reimbursement policies that are illegal. Forget about unfair. They're illegal under the law as it's written today federally, and we have nobody who's willing to enforce it. We need to have folks who are willing to enforce it. I can take one more question, and then unfortunately for me, I have to go to Trenton. Yes, sir.
Governor Christie, we will keep marching and doing whatever you need us to do to help with this fight. I'm just curious as to what the government is doing when you talk about a more holistic approach, alternative treatments. What are they doing in regards to rescheduling cannabis so we can at least study it and look at the different options there?
Listen, I don't know what this administration's position is going to be on rescheduling cannabis. I will tell you this: we have medical marijuana available in our state for a wide variety of ailments. I have no problem with using it in that context. I do have a problem with legalizing it for recreational purposes. And there's a lot of debate about that and a lot of argument about it, and that's fine. Everybody can have their own opinion on it. I don't know where the administration will ultimately come down on all of that, but what I will tell you is it's not restricting our ability to make that available for people who have ailments that need that treatment and physicians who care to use that and believe it's an effective treatment. I have no problem with that. I think when we range into the recreational side of things, from my perspective, I don't think that's the right way for us to go, especially when many states like ours are making marijuana available to people who have ailments and have pain to be able to use that as an alternative treatment. So I think that there's nothing the administration has done so far to restrict our ability to do that in New Jersey. We started that program at the beginning of my administration in 2010, and we've been running it for the last 8 years without any interference either from the Obama administration or now from the Trump administration. But again, that's a state-by-state determination. I don't know what they're going to do in terms of examining a rescheduling of it. That's a bigger issue that Congress is going to have to decide along with the administration. But I've had no objection to the way we've run our medical marijuana program because it is being utilized for people who suffer from real pain and believe, and their physicians will say they believe this is the best way to treat their pain. If this is a physician-based program where physicians make these judgments, I'm okay with it. If it becomes broader, I have bigger concerns. That's probably the subject of a whole nother panel. Yeah, right.
Governor Christie, very last, very 10-second comment.
Okay.
These drug companies are making drug-resistant or abuse-resistant opioid. They should know there is never an abuse-resistant opioid. They are making, this is their excuse to make stronger and stronger and stronger opioid. The same guy I talked, a billionaire guy, he had the synthetic pharmaceutical grade cannabis with him. Pharmaceutical grade, kratom they had. These people, if they start using these things for pharmaceutical development, it will be much more, but they know those things won't make money. The opioid, which are stronger in the name of abuse resistant, they make money.
Yeah.
And people will find ways to break those opioids.
Sure.
You know, it's like a speed detector. You know, you have a radar and they will find something else.
Well, listen, I don't disagree with anything you just said. Fact is, though, that we have to approach this from two perspectives, in my view, on the pharmaceutical companies. It's not only holding the folks responsible who started this epidemic, and New Jersey is suing those pharmaceutical companies, and I think that, you know, that's something that's going to happen probably with most states across this country. But the second side of it is, we've got to get the companies that have not been involved in opioids to be involved in helping to fix the solution. We brought together J&J, Merck, Pfizer, Novartis, Novo Nordisk, and all of them have no involvement in the production of opioids. And they're like, why are you bringing us in? I'm going to bring you in because you have to come up with the solution. You know, you can't just put your hands up if you're a pharmaceutical company and say, well, I didn't profit from opioids, therefore don't talk to me.
Why can't we incentivize them as we did for solar?
We can, and that's the program that we now have them to agreed to work with NIH, and NIH funds can help to incentivize them to take. They've told us they have 42 different compounds that are currently under R&D at those companies that deal with non-opioid pain relief. And our point to them is work with NIH, let NIH examine those as an honest broker. Examine the ones that are most advanced, most ready to go to the approval process, and then NIH will invest in those, along with the pharma company, to be able to get it to market more quickly. And that's where I think the government can be a real effective partner in all of this, by getting these other pharmaceutical companies, the non-liable actors, to be able to come in and be a part of the solution. As if they're not going to be a part of the solution, they're part of the problem, and that's what I told them. When we brought them in front of the commission, we said, you know, it's not good enough to tell me you didn't make money off of this. It's not good enough. You've got to be a part of solving it now. You have enormous resources available to you, both intellectual resources and financial resources, and so does NIH. They should work together to come up with alternatives, because I think most physicians, if they had an effective non-opioid alternative to dealing with pain that was not a treatment but was a pill, they'd use it. They don't believe they have it. And so we need to be able to create those as one in a whole variety of potential treatments and therapies, as we talked about before, that puts this decision in the hands of the physician and the patient, and not in the hands of the pharmaceutical company. And if we do those things, then, you know, that's going to be really helping us to be able to deal with this problem at its source. So I thank Dr. Gupta for what you're doing and the fight that you're leading. I'll continue to be a part of it. Thank all of you for coming today, for your really good questions. I'll come right around there and grab your card on my way out the door. And I appreciate all of you listening to me today, and thank you for participating.
Keep with the guys.
Yeah, sure.
Sure. Happy to.
Jack, can you take this picture? Yep.
Just do a couple. Just until they do their photos.
I don't think that's it's one of the big guys. Christie, that doesn't normally happen in this cell.
Okay. Can you come back? Okay. Look at here, everybody, this camera. Please.
Ed.
1, 2, 3. One more.
Dr. Ross.
Dr. Gupta, come here. Squeeze in, ma'am. Look at here.
Yes,
this
I'm in.
camera. 1, 2, 3. Good. Thank you. Thank you.
Great.
Thank you. Thank you.
Thanks. Leah, my buddy. Yes. One more real quick. Sorry. Yes. Sorry. Guys, sorry, they're going to do another picture really quick. This is
Hop in here.
yeah. Riley? Yeah.
All right, here we go. 1, 2, 3.
Thank you.
I told you. I told you. I've been telling you guys this for months, and you guys bashed me off on it.
No, that's cool.
He helped me.
That took someone else to tell you.
Yeah, sometimes it does. We're changing our whole strategy.
You know,
Well, he's always in the first.
But you know what?
Tell me when.
we can do it like.
Amazing
we can
job.
get ready to
With my friend.
No.
I'll do it.
Okay.
Whew.